Hi colleagues, as each day passes, I continue to be astounded by your efforts in the face of unprecedented pressure. I do have some further information for you this evening, following a meeting that I have had with Jeane Freeman, our Cabinet Secretary for Health and Sport, and following some joint work between the CPS Executive and our NHS Primary Care Community Pharmacy colleagues. First, the Cabinet Secretary wanted me to pass on her thanks for your continued dedication, and I'll now talk you through some of the actions that were agreed upon today. The timescales have not been agreed, but I can assure you that all our efforts are being made to move as quickly as possible on all the fronts that I'll talk to you about. I hope that you will agree with me when I say that these steps are welcome, though I must be clear, there are some asks from government as well. Let's start, I hope, with an easy one for you. PPE, protective equipment, is now intended to be provided to community pharmacies for the purposes of deep cleaning, and that should commence once our colleagues at National Procurement have been instructed to do so. Testing for COVID-19 is a little more complicated. The lab capacity in the NHS and the current policy on testing means that although community pharmacy staff will now be included in the group eligible for testing, this can only be made available for those who are symptomatic at this time to allow them to return to work. We know this means that it is difficult for those of you who are affected by the household isolation guidelines. We made our case strongly on your behalf, but the current policy stands for pharmacy and indeed for all other healthcare professions. We also have agreement that the redeployment of NHS pharmacy and perhaps other health and social care staff will now be initiated, with community pharmacy being one of the beneficiaries of this along with hospital colleagues. Ms Freeman understands that community pharmacy is the front line and is willing to take the step to protect and maintain the resilience of the network. Speaking plainly, this means that we collectively should try and maintain established opening hours and stay in the mid and long term to that. I know today's announcement on the schools closure makes this incredibly difficult, but we are awaiting word on what provision will be made for the children of healthcare workers. The intention is pharmacy staff will be included. So until the cavalry arrives, we are working at pace with the NHS community pharmacy leads to set a new interim opening hours policy. This is not yet finalised, though we expect it will be by tomorrow. Broadly speaking, this will allow pharmacies in all areas to close for an hour either end of their established working day and for an hour at lunchtime to regroup, allow you to recover, clean, or whatever else needs to happen. You will not have to tell the boards about reducing to this level of service, but if you need to reduce further than that, you really should inform them. The contact details you need should you be in this position, can be found on our site by searching closure, so on our website. The supply of medicines continues to be the primary focus, and we know that there are issues with ordering processes. I would repeat my call to utilise the unscheduled care patient group direction where a patient is in front of you and needs their medication. And if you are experiencing any issues with patients being able to reorder prescriptions at their surgery, please feed this into your local NHS community pharmacy support team, who will do what they can to influence that situation. Continuing to act as the first port of call for minor health conditions, excluding those consistent with COVID-19, will be critical in the coming weeks and months. We know that referrals to all areas of the service, including community pharmacy, will increase as demand across the country increases. And we have been informed today that local primary care hubs are being established, which will help people to navigate the system, which, as with NHS 24, will result in some people being directed to pharmacy. To this end, the current minor ailment service will be open to everyone in the very near future to allow you to treat them on the NHS. I would ask you to focus on this as an assessment and supply tool only. It will help treat everyone in the same way. Now, we're not talking about the ideal vision of the NHS Pharmacy First service that I and the rest of the team spent the last few months describing to the network. I know that would not be deliverable at the moment, and therefore we won't do so straight away. The exemption that you can use to register people will be under K, War Pension recipient. Beyond that detail, the network is trusted to run the service and support the people of Scotland. In the background to all this, we have to ensure that the network is supported financially in these turbulent times. And so to that end, we have asked Scottish Government to increase the advance payment percentage from 90% to 100% with immediate effect. The rest of the detail on ensuring financial stability will follow in due course, and I am working on that. So that covers all the information we have up until this moment, this evening on the 18th of March. And please get in whatever rest you can and that is possible, and be assured your contribution is valued more than you can possibly know. So thanks again, everybody. It's amazing what you are delivering.